She absolutely loved music. She loved Yo Gabba Gabba, sing and dance and play. She was learning to ride her bike before she passed away.
Betty Wattenbarger died last year from flu complications. Her family says she was treated by a nurse practitioner at an urgent care in North Texas who didn't have enough training. We shared their warning with you last month. They insist patients see a doctor, especially during this pandemic. It was one of our most talked about investigations. Who should treat you?
In Texas, nurse practitioners can treat patients as long as they're under a doctor's supervision. And now there's a renewed push to allow them to practice independently. As KXAN investigator Arzo Dost explains, they hope to fill a gap which the coronavirus surge is exposing, especially for those in rural areas of Texas.
Hello, how are you today? We're following up with you today regarding your recent hospitalization.
Joanne Cabello is here for a checkup after a fall. She's been coming to Ferguson Family Practice in San Marcos for years.
I don't know where I would be at if I had not come here.
The 66-year-old, along with her entire family, is treated regularly by nurse practitioner Ashley Ferguson instead of a primary care doctor.
We're going to print out the last office visit on this patient.
A nurse practitioner is an advanced practice registered nurse who has extra training, education, and certifications.
I see both insured and uninsured patients. But, you know, I have a pretty large population that is dependent upon Medicaid, and a lot of these patients do not have alternatives in this area of people to go to that are open to taking new Medicaid patients.
Ferguson opened her clinic more than 5 years ago. She can do that under Texas law as long as she works with a supervising doctor. Hers is in San Antonio, and that oversight comes with a price. The Texas Nurse Practitioners Organization says a recent survey shows that nurse practitioners are paying supervising doctors between $1,200 to more than $87,000 a year.
We discuss, cases as needed. He does review charts for me.
Texas law says the supervising doctor can be anywhere in the state and must meet once a month with the nurse practitioner to review charts. Right now, nurse practitioners cannot prescribe some medications like narcotics and depressants outside of the hospital and hospice settings, and they cannot sign death and birth certificates.
There's a lot of paperwork that depends upon, we can't sign, my collaborating physician has to, and so that can delay care for people.
Access is an issue for a lot of people. The further remote you get, I think the more it is.
David Bushnell is also a nurse practitioner.
We are the ER coverage. We are the rural health clinic coverage.
He works at the only hospital in Big Lake in West Texas. It's a 4-hour drive from his home in New Braunfels.
When I'm at work there's been 2 doctors and a nurse practitioner that work during the week. There's another nurse practitioner from Abilene that's there when I'm not there, as I work every other week.
State Representative Donna Howard, a former nurse, pushed a bill last session that would have allowed nurse practitioners to work independently after more than 2,000 hours under a doctor's supervision. It would have also meant that nurse practitioners could perform and interpret diagnostic tests, formulate medical diagnosis, and manage chronic diseases. The bill didn't make it out of subcommittee.
I think that the pathway may be a little different now with our experience with COVID and the recognition of the lack of adequate provider care for Texans, especially in our underserved areas, in our rural areas where we've seen hospitals close, clinics close.
More than 30 states have moved to allow nurse practitioners to work independently, most recently California and Florida. Half of those states say nurse practitioners can open their own practices after physician oversight for a set number of hours. Nurse practitioners are hopeful Texas could be next, but some doctors groups say they don't have enough training to practice on their own, and that puts patient safety on the line.
If you want to function independently and make all the decisions, and with that comes great responsibility, you need to have the level of training to do it safely and responsibly.
Dr. Ari Brown is a pediatrician in Austin. She's also a member of the Texas Medical Association, which advocates for physician-led team care for patients. She says nurse practitioners play an important role, but their level of training makes a difference.
I gave up a decade of my life to become a doctor. If you want to function as a doctor, go get the training to be a doctor.
Dr. Brown says they especially should not be providing care in rural areas.
That's probably the worst choice you could provide, is providing suboptimally trained people for a community where you don't have backup.
Their hemoglobin A1C is less than 7. We have a lot of training, and if anything we feel like is beyond our scope, we refer. I mean, there's never a hesitation on my part to refer when I feel like something's beyond my scope.
Ferguson says it comes down to access to care for patients who already have limited options, especially now during the pandemic.
She's kind of like family now. I trust her totally and completely.
Arzo Dost, KXAN investigates.
Just last month, Governor Greg Abbott proclaimed this week Nurse Practitioner Week in Texas. His proclamation says nurse practitioners are invaluable members of Texas healthcare community and uphold the standards of excellence of the Texas Board of Nursing. As Arzo mentioned, California is now the latest state to allow nurse practitioners to work independently. It is why Physicians for Patient Protection is already talking to lawmakers in Texas to make sure it does not happen here. They say nurse practitioners need stricter requirements than what the state currently allows. They also dispute studies that nurse practitioners point to as their safety record. You'll find those studies and can explore what medical shortages Texas is facing, especially during the pandemic. It's all at KXAN.com. Just click on this investigation.
Finally, an update on Betty Wattenbarger's death. Her family says after our story, they found out that the nurse practitioner is no longer being supervised by the doctor. Her supervising doctor told us he has no comment. The nurse practitioner has not returned our calls.